It's important for child protection practitioners to understand what public health measures will likely be enforced in different contexts to prevent and control the spread of disease. And knowing what these prevention and control measures are will provide us with much better insight into what some of the potential protection risks are. Hi, my name is Tina Fisher. I'm a child protection practitioner and researcher focusing primarily on international humanitarian child protection. I am a member of the Protect Non-Consulting Group that compiled this guidance note on the protection of children in infectious disease outbreaks. And I'm also a doctoral candidate at the Mailman School of Public Health at Columbia University.
Can you introduce the guidance note in the briefing paper, taking into account kind of how is it structured and what is the content, what's there if people take a look at the full paper?
The guidance note on the protection of children in infectious disease outbreaks aims to provide practitioners with guidance on how to engage in responses to infectious disease outbreaks to ensure that children's protection needs are taken into account. It's essentially divided into two parts. The first part explains why children are particularly vulnerable during infectious disease outbreak. And the second part describes what some recommended actions are that could complement the actions that are already in the minimum standards for child protection and humanitarian action to better ensure that children's protection needs are addressed. There's also an annex to the guidance note, which provides information for child protection practitioners about infectious diseases. Included in the annexes are, for example, descriptions of how infectious diseases are transmitted, what modes of transmission are. We also describe what some of the causes of infectious diseases are, and also described are some of the public health measures that are used to prevent and control the spread of infectious diseases, which are important for us to know about to inform our responses. There is also a briefing paper that was developed to accompany the guidance, and essentially the briefing paper provides a summary of the content of the guidance, and the aim is to try to make the guidance note more accessible to child protection practitioners and to give them an insight into some of the content that's further described, further fleshed out within the guidance note.
Can I ask you to get specific about children, and why do we need a guidance note that particularly looks at protecting children?
So children are particularly vulnerable to infectious disease outbreaks, mainly for three reasons, or there's three reasons we wanted to emphasize within this guidance. The first reason is that children have specific susceptibilities to infection due to their developmental stage, due to their evolving capacities, but also due to their proximity to caregivers and their dependence on caregivers. Children are actually exposed uniquely or have unique exposure pathways to infection. They can be infected, for example, in utero. They can be infected during delivery. It can be infected through the giving of breast milk by a mother. So these are ways that are actually unique to children that adults don't have. They're also much less likely in many contexts to adhere to some of the sort of like the hygiene awareness-raising behavioral messaging around prevention of infection. So they're less likely to wash their hands consistently and do other routine acts that actually can prevent or reduce the risk of infection. The second reason why children are particularly vulnerable during infectious disease outbreaks that we highlight in the guidance is that there's a recognition that outbreaks can actually disrupt, and they do disrupt often, the social ecologies or the environments within which children grow and develop. Infectious disease outbreaks can disrupt families in terms of how families function. There can be loss of income within the family due to a caregiver's illness. Infectious disease outbreaks can disrupt large communities in terms of the cultural way of life. You have fear and anxiety can present themselves, which can disrupt social interaction. But you can also find disruptions just in terms of children's, their closeness to their caregivers. If you have a caregiver that is put into quarantine or that has to be isolated due to their potential illness, this can have huge effects on children, especially those who are young and who really seek that proximity for their own development. And the third and last reason that we emphasize in the guidance, the reason why children are particularly vulnerable during infectious disease outbreaks, has to do with the prevention and control measures that are used within public health to prevent and control the spread of disease. As much as they are necessary and absolutely important to controlling the spread, they can actually expose children to additional and new risks. Examples of ways in which public health measures, although again, I want to stress, absolutely important and critical to prevent and control the spread of disease, the ways in which they can potentially pose new and additional risks to children include both in the preventive measures that they cover and in the control measures. So some examples of preventive measures and the potential risks these can bring to children or expose children to are in the area of, for example, immunization. So during immunization campaigns, there are often children who are out of the scope of the campaign, either because they are living on the streets or because they are otherwise, quote unquote, invisible or marginalized. These are children who may not be reached, not because it isn't the intention of the campaign to reach these children, but just because they are not necessarily part of the remit. These children, by not being immunized, are of course at additional risk of infection. In terms of educational measures, we also know that these measures, unless they are very carefully tailored and they are targeted to different age groups and the understanding of these age groups, they can in fact also create fear and anxiety, and they can elicit or induce behaviors that also put children at additional risk. In terms of prevention measures, environmental measures can also create risks. And these are measures that essentially try to prevent the spread of disease. So an example there could be vector control. Vectors are conduits of disease. So for example, mosquitoes. Mosquito is a commonly found vector. So in our effort to try to control these vectors, mosquitoes, for example, those efforts can actually also put children at additional risk. An example there is when the control measures are actually misused for other reasons. So there's an example from East Africa where mosquito nets were distributed, but instead of them being used to protect particularly children under 5 from being bitten by vectors or mosquitoes, they were actually used for purposes of fishing. What I've just described are some examples of preventive measures that can create additional risks for children, but there are also control measures within public health measures that can also raise additional risks or expose children to additional risks. Control measures include both treatment, so the treatment of disease. By treating a disease, you're controlling the spread, but also by actions such as isolation and quarantine. So in terms of treatment, how can treatment create additional risks for children? We've identified that this can happen in a number of ways. Health facilities, for example, may not have specialized training or even medical supplies that speak to the clinical care for children. Children may not receive timely treatments, or they might not be diagnosed in a timely manner because the way they illustrate and show symptoms might be different to adults. It might even be that during treatments, caregivers are unable to provide the type of attentive care that they would normally provide to their children just by virtue of their children being in the treatment center and them not being with them. In terms of isolation very specifically can create heightened risks for children. When, for example, children are admitted into designated isolation units, caregivers will be unable to provide the attentive care they usually do. Could also be that, in fact, the parent or the caregiver is admitted into an isolated unit, in which case the child might be unattended to or uncared for. But also patients who have been in isolation units often risk becoming stigmatized. And this is an aspect that was heightened or that was repeatedly mentioned with regards to the Ebola virus disease outbreak in West Africa. And that stigmatization of just having been in an isolation unit is also something that can create extra risks for children. In terms of quarantine, there's generally 2 types of quarantine or 3 types of quarantine that are used. There's home-based quarantine, facility-based quarantine, and what's called zone-based quarantine or quarantine at the level of the community or the village. Each of these can present specific risks for children. I can just mention a few. For example, within facility-based quarantine, children may be admitted, but the child's family information may not be adequately registered, which makes it difficult to contact and reunite the child with their family once they are released, if and when they are released from the facility. Quarantining in individuals, children, they may not have access to services that are tailored to their specific needs within the quarantine centers. Oftentimes, quarantine centers are designed for adults. And so when children are placed within them, there's inadequate attention to their specific needs and their services that are required. Zone-based quarantine also can present specific risks to children, although many of these, the ones we identified, were indirectly. And I'll explain what I mean. When zone-based quarantine has been used, for example, in the bylaws that were passed during the Ebola virus disease outbreak, we identified that these zone-based or village-based quarantine measures can actually limit the ability of family members to work. They can limit the engagement that family members used to have in agricultural activities. In areas, for example, where farming is a communal activity, when you're not actually allowed to engage in social activities because of the risk of transmission, so you're not allowed to farm together, this has an impact not only on families' abilities to get food, but that in turn has an ability on the family's ability to have income and address other needs that children have. Access to markets is also logically restricted. If families are not allowed to move outside of their village or community, they cannot access markets. And again, that can have an impact on families and their ability to care for their children. Zone-based quarantine can also have an impact on family separation. What came out of the Ebola virus disease outbreak, some of the reviews highlighted the fact that some family members were actually separated at the time of the quarantine announcement. And that, in essence, prolonged the separation because the family members were not able to reunify during that time. Zone-based quarantine can also have an impact on issues of health and civil registration services. So during the time that communities and villages are not allowed to move outside of their own boundaries, this can curtail access to things like birth registration, which of course has implications for children's well-being and protection in future.
What additional actions would you say are required beyond the CPMS?
The part 2 of the guidance note identifies how we can ensure that the protection of children is a key component of humanitarian responses. And in doing so, it identifies a set of actions that are recommended in line with the different standards. As I mentioned, it uses the minimum standards for child protection and humanitarian action as a frame and describes within each of the standards what are some examples or what are some recommended preventive and responsive actions that can complement what's already described within the standard. Secondly, ensuring that specific protection risks for children are identified and responded to. And thirdly, ensuring adequate strategies to addressing these risks are developed. In the same way that these 3 pillars are used within the standards, the guidance note also reflects these 3 pillars. Just some examples of the actions that are included within the coordination standard, for example, what is clearly recommended is that child protection actors engage much more closely with health actors in the coordination of responses in infectious disease outbreaks. And this doesn't just mean engaging with coordination groups when and if an outbreak occurs, but it actually encourages child protection practitioners to identify and engage with health coordination mechanisms in different contexts where there are heightened risks of outbreaks, to see how within the emergency preparedness planning and the preparedness work around outbreaks, some of the protection risks can be identified and incorporated. It also highlights that unlike many of the responses we've traditionally had that employ a cluster approach or that employ a refugee coordination model, in fact, many of the outbreaks that occur might have a very different coordination structure. And so we as child protection actors need to be quick to identify what those structures are and how best to engage. Within the protection risks pillar, there are protection risks that are highlighted related to infectious diseases across all of the risks that are in there, but specifically the risks related to family separation and working with separated and unaccompanied children, as well as heightened risks of psychosocial distress, are explored within the guidance, and actions on how, together with health actors, we can better identify which children are at risk of separation, particularly around the issues of quarantine and isolation that we referred to earlier, and what some of the psychosocial support needs are of children who are in fact separated in these contexts. So we've incorporated considerations related to that.